Okay, it's been about 12 years or so since my knee surgery. I had both knees done. They did it at the same time, so I was on crutches, hobbling on both knees. I figured I'd share just how it is after surgery, and especially after quite a while like that. My knees will still hurt if I do gardening, or so if you're a priest or you lay tile flooring, you might want to get another career because it's going to hurt a lot. It's been relatively painless for most of the time, except a few months ago I did some gardening on the weekend where I was on my knees most of the time, and then for a month almost straight after, it was pretty painful. I never used to run at all for at least 10 years. I didn't think I could. Then I think it's basically because you have to really baby your knees if you want to be pain-free. And so I finally figured out that the problems, the reason why I get pain again is because I'll twist my knees. If you're sitting and you bring a foot up on the other knee and you just kind of have twisted knees, if you can't kneel at all, that'll really bring in the pain the next day. So basically you keep your knees in a basically straight position as much as you can without twisting them or putting pressure on them by kneeling or things like that. And then if you do that for a while, they'll be pretty good. You won't get much pain, at least I don't. I kind of figure it's almost like a bruise. So if I twist them and put pressure on them in odd angles, it's almost like they're bruised inside, and then the next day I'll feel pain. So anyway, how my run went today, I run around this lake here. It's kind of a donut shape. There's an island in the middle. It's a pretty nice run in the morning. And for the beginning of the run, my knees were hurting a bit, and then maybe a mile, 2 miles in, it stopped on the right knee, and the left knee I still had to be careful from. That's because I was kneeling again last weekend, so I suffered from that. But it's not so bad I couldn't run. It kind of feels like somebody's touching a bruise, so there'd be some dull pain. So anyway, I shaved my knees so you can see the scars. Let's turn this camera around. There's 3 incisions, one at the top. Let's see, where is this one at? You can kind of see it there. When the skin gets closer together, you see the mark. It's pretty minor, and when the hair grows over, you can't see anything. And then there's the third one there. So here, and here, the camera went in, some suction or fluid exchange thing went in, and then the knife went in, and they did it on this side. Let's see if I can find the scars here. Yeah, so you can see when the skin folds, and there's like that. You see the scar when it stretches, it's pretty minor. It went in there. Somewhere here, I can't find that one. I think it's there and there. So scarring's all right. I've been fine without any other supplements or anything, so it's been pretty good. I can't complain. It was fairly painful before the surgery. At night it would hurt. You'd go to bed and you didn't know what to do with your knees. Now I sleep on my side with a pillow between my knees. It seems to feel better if the knees are in that position, a little bit bent, and with a pillow between them so they don't push against each other. And I sleep pretty comfortably that way. Before it was fairly annoying to get in a good position. So, and running with an iPhone's great, so it makes the workout a lot better. There's a couple really good apps that are free that I guess I'll do another video after this and show you about those. I think the reason why I got knee trouble in the first place is I used to do a lot of skateboarding as a teenager, and then after high school I was a missionary for the LDS church. The guys on bikes with the suits and the black name badges on their chest. I did that for 2 years, and that was in England. So in England you're riding uphill at least 80% of the time because downhill goes so quick that the majority of the time you're trying to get back up hills, and there's hills everywhere there. So I think that tipped the scales, all the mountain biking, riding around, and it got pretty painful there. So when I came home, I went to Dr. Ting in Palo Alto. He did an awesome job, and I would totally recommend him if you're looking for a good doctor. I have a friend who went there too, and he got great results. So anyway, that's about it.